Hello everyone, welcome back to my channel. I am Arushi, a second year dermatology resident. And a lot of you wanted to know how you can approach your first year residency so that you make the most of it. I was not sure whether I was the right person to make this video or not, but since I get one or two messages almost every day since the past few months, I thought I'll give it a try. But anyways, so first and foremost, I think when people join dermatology, they think of only the lifestyle. I think first year of residency is not the time when you should be thinking a lot about your personal time or plans. First year, in fact, is the time when you should be on your feet. Sometimes you might feel like your patient, when you give patients steroid, they might become diabetic, they might have hypokalemia. And in situations like these, when you have to manage these conditions, you might feel like, this is not a dermatologist's task. I don't need to be seeing so many calls, I don't need to be doing so much work. But that, I think, is also the time when you should realize that you won't have the liberty of getting an endocrinologist's opinion or a medicine person's opinion all the time. So these are basic things that you should also know even if you are a dermatologist. So don't shy away from work, don't be lazy, and don't expect a good lifestyle from the first day of your residency. You should always remember the fact that you are a first year resident and it is in your own benefit to make the maximum out of your first year by attending to as many patients, to as many calls as you can. Second thing that I would like to say is, like, be very patient, and also you won't really understand everything that is said in the rounds or everything that is discussed by the seniors from the first day. So be very patient, everything will fall in place eventually. Now, the third and the most important thing that I want to say is residency is very different from anywhere else that you have been. Not everybody is going to like you, and you are also not going to like everybody, but you still have to maintain a decent professional relationship with everybody, and you have to make sure that all the work in the ward and the OPDs and the minor OTs gets done efficiently. Sleeping habits, just keep a big bag with you, and if you're a girl who might not have pockets in her clothes all the time, keep a small sling bag also. If you do in dermatology, something like peels, lasers, this is something that fascinates people a lot. But what I have learned is these are not things that need a lot of time and effort to learn. You can even learn them in workshops after your PG is done. But clinical dermatology is something that you can't learn later. You will not get so many patients, you will not get so many people to discuss them with. So clinical dermatology is something that you should focus on much more than any of the procedures that are done in the minor OT. You won't really get time to read, so you have to make a habit of reading on the patient's bedside. From that I mean that like in between your work breaks, or sometimes when you have a night shift, you will get time to come to your room and read as well, but you should try to read at your workplace also a little bit during work breaks. And also, I feel like all the books are very expensive. There's they start from 40-50,000 and then they go up to lakhs of rupees. And also because I find it very tiresome to carry books around, and that is why I prefer that you keep that is why I'll suggest that you keep soft copies of everything and you read from them. Okay. That said, if you're a person who likes to read from books, do not shy away from investing into something that would mean a lot to your future. So yeah. And another important thing, like, this is one of the most important things that I feel a resident should know. A resident should not be the reason of somebody's death, and for that you have to remember that the drugs that we deal with in dermatology are very different from the drugs that we have anywhere else. So some drugs like cyclophosphamide, mycophenolate mofetil, hydroxychloroquine, all the retinoids, and steroids, all of them have a very different bandwidth of side effects than any of the other drugs that we're used to using. So you should actually familiarize yourself with the side effects of all of these drugs, because if you don't know any of these things, you might actually end up hurting your patients. And about the books part, I think Rooks is the standard textbook. You can go for Bologna, Fitzpatrick's. IADVL's textbook is also there, so you have to just go through them briefly, and whichever one you like more, you can continue with that book. For pathology, I think Whedon's is a good book. STD part, Kings and Nichols, people usually read, although forgive me, although I read it from the standard textbooks only, but there is Kabir Sardana's book also, and there is Kings and Nichols also. for the venerology part. For the leprology part, we have IAL and Jopling's, and for the drugs part, you can read Wolverton's. I think that is all the books that you need. That said, in the wards, what helped me the most was DYP and Ward Rounds. Ward Rounds are a really nice book, so you can go for that. This is about the books. Rest, I think you should go through research papers and up to date and things like that. There are a lot of associations and a lot of conferences and a lot of academic things that go around in the world of dermatology. For the first 2-3 months, I think it's a good idea to not bother yourself much with these things and just focus on and to just focus on the ward work and the books and all. Later on, you can join these groups. Okay, all right. I hope it helps. In case of any queries or anything that you might want to know, my Insta handle is passionate dermatologist. Just hit me up and I'll get back to you. Bye. Take care.